Good morning, students. Today, we are going to explore an essential and practical area of pharmacy practice, pharmaceutical compounding. Let me start with a simple question. What happens when a patient cannot use a commercially available medicine? For example, a child who cannot swallow tablets, a patient allergic to a preservative, a need for a customized dose. In such cases, compounding becomes critical. Pharmaceutical compounding is the art and science of preparing personalized medications for patients based on a prescription. Pharmaceutical compounding can be defined as the process of preparing, mixing, assembling, altering, packaging, and labeling a drug or device according to a prescription. Why is compounding important? Provides individualized therapy, adjusts dosage strength, changes dosage form, e.g., tablet to liquid, removes undesirable ingredients, improves patient compliance. Without compounding, many patients would not receive appropriate treatment. Compounding can be classified into three main types. 1. Simple compounding. Basic preparation using standard formulas. Example, preparing oral rehydration solution. 2. Moderate compounding. Requires calculations and some special techniques. Example, preparing creams, ointments. 3. Complex compounding. Requires specialized training and equipment.